Thank you. At this point, I'd like to ask our Township Health Officer, Mr. Lawrence Taltone, to provide us with any announcements and his monthly report.
Good afternoon, Mr. Chairman and board members, and to the audience. The only announcement that I do have is Dr. Len Donato will be here. He'll be a little late. As far as announcements are concerned, there are no other announcements. I'll go into my report. You know, Doctor. Yes, I was just giving him a chance to sit down. Under food facilities, bathing places, inspections, and citizen concerns, we, over the last, from June the 1st to September the 11th, we inspected 28 food establishments. Workplace Safety Committee, I'm a part of the Workplace Safety Committee, and we have a meeting once a month as required. This is a committee that saves the township on our insurance premium by conducting meetings and doing inspections for township owned facilities, buildings like the library, the township building, anything that the township owns. We do inspections on them and make recommendations for correction. We also review accidents that township employees have and try to find ways to prevent those accidents from happening or reoccurring. So it's one of the things that we do. Another thing we do, we have one coming up, it's lunch and learns. During our lunch breaks, we take employees who have topics of interest, and during our lunch break, we will talk about those things, and hopefully we'll have information that will be helpful to other employees. We also did 31 bathing places and 87 citizen concerns complaints. Ranging from, we had a fire at one of our apartment buildings where 26 people were displaced. We went into our emergency management mode and worked with the apartment buildings in finding housing, adequate and appropriate housing for those 26 units. We dealt with a range of animal complaints, from mice to raccoons and dogs and cats, and the normal things that we go through with the animal situation. We dealt with several complaints, property maintenance, ranges from trash to sewage backup and those type of things. Also some quality of life issues from student parties and that type of thing. We placed some things on the website, how to protect family and yourself from the flu. It's on the township website. Public notice regarding mosquitoes. That program is continuing throughout Pennsylvania, in particular Delaware County. We're going to get an update on that on September the 30th when we have the Delaware County Local Boards of Health meeting. And we also have we had here recently, which was yesterday, the Wayne Fall Festival, which was a successful event for the township. That was on North Wayne Avenue. And upcoming, we have the Friends of the Willows Harvest Fest that's coming up October the 25th of 2009. And then on the back of your, the last sheet, we have the health alerts, advisories, and updates over that period of time. Also, on September the 17th, 2009, which was last week, I had the opportunity to attend the Delaware County Council's meeting on their pandemic preparedness and response planning. That's a plan that the county has in place, and it's ready to go in the event that we have to dispense vaccine for the H1N1. What will happen is, if you remember back a couple of months back when we showed the film that Philadelphia Health Department had put together on the pods and how the pods work. And if in the event that a distribution of medicines is required, Delaware County is set up through pod sites, pods or points of distribution, locations where you would go to get the medications. Delaware County is set up for that process, and in the event it happens and it's necessary, we're ready to go. Mr. Chairman, so ends my report.
Thank you. Would you, in addition, over the summer, maybe a couple of weeks ago, 3 weeks ago at most, we had a spraying in the township for mosquitoes. How did that go? Could you report on that?
It actually went well. We had different from the past sprayings that we had. We had actually had 1 or 2 people who called and wanted their area sprayed, which was a bit different from the past where we had a lot of people in opposition. It was a mosquito spraying for the larvicide, not the adults, which has less of an impact on the community, because with the adulticide, what they do is they go around with a little truck and they kind of spray it. It's a light mist aerial spray. With the mosquito, the larvicide, it's typically a little granular type of product. But it did go well, and we haven't had any positive to speak of, meaning that when they get concerned, it's a level over 100 or over, that are positive as far as the mosquitoes that carry West Nile. So it's been going pretty good, and thankfully we'll get into the cooler months, so where it's going to kind of die off for us.
Thank you. Are there any questions for Mr. Taltone based on his report?
This isn't so much a question as a comment. I mean, we're sort of set up for the pod distribution. I know the plan is in place, but the plan, I mean, I participated in the practice drill, and the plan that for Radnor involves people driving to designated parking lots, getting on buses, and being transported to the high school, and then, you know, after they're through the whatever is being distributed, taking the bus back to the designated parking areas. And I think that and I know, you know, I'm not the only one who thinks this. I mean, I think it's problematic, to say the least. I mean, for one thing, if people are incubating an infectious disease, the very last thing you want to do is be crowding them onto a bus. And secondly, I just foresee, and many people there foresaw it being difficult logistically to actually get people to do this, and just to sort of manage it in that particular way, with the buses being the idea. So kind of yes and no. I mean, I think in this particular season, if what we're talking about is H1N1 flu vaccine, I think it's going to come. I think the vaccine supply will come slowly, and you know, I don't think, and many people will already have become exposed to it, if not already have become ill from the disease by the time we actually get a lot of vaccine. So I think in this particular year, and, you know, although there are issues with the disease, it's not sort of overwhelmingly devastating to kind of everybody who gets it. Yes, there are high-risk groups for sure, and there is severe illness and death resulting from it, but it's not the absolute worst that we could be seeing. So, you know, I don't know that this year we would even have enough vaccine at one time to make it kind of feasible. Certainly to run flu clinics, yes, but not for kind of mass distribution. And, you know, that can be seen in the recommendations so far for who should get immunized. I mean, that's relatively narrow risk groups that are recommended to receive the vaccine when it first becomes available, although it does include all school-age children. But so I think, you know, there are certainly issues to be worked out, but we do have a plan, and there is staff. You know, everyone kind of knows their jobs. I just think that it will continue to evolve. And, you know, I know people are still meeting about it and talking about it, so.
Well, thank you for that, and I think it does bear close follow-up to make sure that these issues and any others that come up as we proceed with this,
Mr. Hayes?
take place.
I omitted and left out two important websites I wanted to make the public aware of. One is www.h1n1npa.com. This is a website that the state of Pennsylvania Department of Health has set up so that people can go to see what's current and what's happening as far as H1N1. The second one is www.delco.alert.org. No, it's delcoalert.org. www.delcoalert.alertpa.org. I'm sorry, messing this all up. www.delcoalertpa.org. And that's a website for the county, Delaware County. And in addition to finding out what's happening in Delaware County, you can also sign up and volunteer on this website and get information via your telephone, text message, and that type of thing. But you'd have to register for that. So I just wanted to add those two things and make that aware for the public. Thanks.
Thank you for that. And just before I turn the meeting over to our chairman, Mark Bullock, I just want to, on a related subject, and Amy, if you want to jump in on this, just make sure that folks listening to this program and all of our citizens understand that it's still important for people to get the seasonal flu vaccinations and to follow up with that as well.
Yeah, that's a great point, Herb. And physicians, for the most part, do have both the injectable inactivated vaccine and the live intranasal vaccine. So for seasonal flu vaccines are around, they're available, and definitely it'd be great to call your usual source of care and schedule your seasonal flu vaccine as soon as possible. The H1N1 vaccine, the novel H1N1 vaccine, is going to be produced in the exact same ways as the seasonal flu vaccine. It's on the same production line. There's nothing especially different or special about it other than the strain of H1N1 that's in it. And so it will also be available as an intranasal vaccine. In fact, the first batches of it are that's what's expected to be available first. And for the seasonal intranasal vaccine and the novel H1 influenza vaccine, they don't want to be giving people two live, the problem is two live vaccines at the same time. So they don't want to be squirting one in one nostril and one in the other. Now you can mix and match one shot of an injection of one with a intranasal of the other. But since what I'm saying is that the first batches of H1N1 are going to be the intranasal only, and there needs to be although the final recommendations are not out, but there's expected to be a 28-day waiting period recommendation between getting just the intranasal vaccines, the two live virus vaccines, as there is between any live virus vaccine. So that's just something for people to consider. I know that some pediatricians who I've been in touch with are leaning more towards giving just the injectable vaccine so that there won't be that problem of having to have that waiting period for the highest for the people who are eligible for the intranasal vaccine. So
Is it?
I don't know if that was confusing or not.
No, I think that's very helpful for me because that's the first time that I now understand there's actually two. For people, which one is the preferred one to get, or is that not a fair question?
The live intranasal seasonal flu vaccine, there's only one brand of it, it's Flu Mist, is recommended for healthy people ages 2 to 49. So in other words, some of the people who you most want to be protected, such as those with asthma, cannot get that vaccine. as well as, because flu vaccine in general is recommended for people 6 months and older. And this year, for the first time, the Centers for Disease Control and Prevention, the CDC, has recommended annual seasonal influenza vaccine for all children ages 6 months through 18 years of age. So all school-age children are recommended to get the seasonal influenza vaccine. For the novel H1N1 vaccine, that is recommended because the supply will be limited at first. Among the groups recommended to get it initially are all children, because the data so far show a particular risk of hospitalization, severe disease to the extent of requiring hospitalization among children, in particular less than 2 years of age, but under 5 years of age, and really up to age 24. That is, pregnant women as well, show a higher rate of hospitalization than from the seasonal influenza. So it's kind of a problem. It's expected that the restriction will be the same for the novel H1N1 live intranasal vaccine, that the recommendation is likely to be only for healthy people. So again, some of the highest risk people, such as those with chronic conditions, would not be eligible for that, as they are not for the flu mist. Although the ACIP recommendations have not come out for the novel H1N1 vaccine, that's certainly the most likely scenario. The data so far on effectiveness, the intranasal vaccine, seasonal influenza vaccine, looks in general to be a little more effective, as might be expected, because it provides a protection at the respiratory level where you're first exposed to the virus. But certainly the injectable is very effective, very good. I know that just from talking with many pediatricians around the state, that there's, as you might expect, greater acceptance of getting by the children and parents of getting a intranasal vaccine, a squirt up the nose rather than an injection. You avoid the whole drama associated with that, and it's been quite well accepted. So if people will get that rather than no flu vaccine, of course, that's good. So, but it pretty much equivalent at this point. There certainly is no preference. There's no official recommendation of any preference, and the data are not that strong. So.
And this is in addition to cleaning your hands frequently, perhaps using the alcohol rub or whatever the cleanser is.
Yeah, washing your hands, it's always a good habit to get into when you first come into the house from being outside, before you eat, after going to the bathroom, before preparing food, and as well to try and as much as you can to get out of the habit, rubbing your eyes, rubbing your nose, that it's, as well as getting enough sleep, eating well, getting exercise. All those good health habits really make a difference in how your body is equipped to, to handle a virus, any virus. So, but you're right, those are all, and covering your cough, of course, coughing into your elbow rather than coughing onto your hand. If you cough or sneeze onto your hand, washing it as soon as possible, using a tissue and disposing of it immediately if that's possible. And the hand sanitizers are good. Washing your hands is generally better, but hand sanitizers are good, and I know the schools have put more sanitizers around. The other website I wanted to mention is the rtsd.org website is very good as far as information for parents, for teachers, and for people in daycare. The www.cdc.gov/flu has excellent information for both workers and parents who have children in daycare, as well as professionals, the general public. So the CDC website also is good.
They've had a nice push in the schools too on educating the students. There's signs up all over the school, extra hand sanitizers. They even sing a song while they wash their hands, a lot of the younger kids, to teach them how long to wash their hands. So everybody's really doing a great job with that.
What's the song?
I think it's Happy Birthday.
Very good. Thank you very much. I apologize for my tardiness. Speaking of schools, I have to now allot a sufficient amount of time to get past the high school. Herb, you were saying that the minutes.
We haven't done the minutes.
Great. So I'd ask everyone to take a few moments and review the minutes from the meeting of June 15. Can't believe it's been that long.
Larry, I guess I just had one question about the student parties. Is that just at sort of the regular level? Has there been any increase in that as a problem, or?
Well, usually there are certain times of the year where we have that problem when the new freshmen come in and they think they're in the 13th grade and, you know, they want to party instead of learn. And so they have the beer parties. And so it's sort of routine, but it's, you know, it has its time periods. It usually settles down a little bit once they're in class a couple of weeks, but it is routine.
Sorry, I missed that comment. The just in the medical environment, Larry, it was the Senate Finance Committee had outlined a proposal, and it was the House Ways and Means Committee proposal, which was about $1.2 trillion. The Senate finance mark, as I last saw it, was $900 billion. So just wanted to make that clarification in the minutes. I know 300 billion.
The other
among
item
friends
in
is
the
a lot,
minutes
but-
is that there's under the section minutes/health officers report, we approved the minutes for the March 16th and April 20th meeting. However, the minutes before us are those of the June 15th meeting, which we have not approved yet.
Right. The June 15th meeting. The June 15th are the one currently being approved.
Right.
Any other additions or corrections? So with those additions and corrections, I would ask for a motion to move the minutes.
So moved.
Is there a second?
Second.
Okay, all in favor?
Aye.
All right, the minutes are approved as amended. We can go to old business, EAC update.
Well, the EAC did meet twice over the summer. Unfortunately, the meetings were scheduled at times when I was not in the area, it being vacation time. What I think I will be able to do for the future, in addition to these monthly verbal reports, is work out a way of getting the actual minutes of the EAC meetings, once they're approved by the EAC, emailed to these board members, and you can actually read in greater detail and then maybe at subsequent meetings raise questions or do that via return email, and we can have a greater possibility of dialogue between this board and the EAC in that way, I think. So if there are no objections to doing it that way, that's what I would like to pursue.
Great. No, I think that's a great idea. And I know this, you had agreed to take this on as kind of an interim step. Are you still happy with that, comfortable with that?
What I did indicate is that perhaps at our December meeting, I'll or even earlier, but it's a little early yet.
Okay. All right,
Thank
so you'll be able, why don't we wait to the December meeting, because then we can, we'll elect our officers again, so we can gauge people's interest as well. I think that makes sense. Speaking of that, I have a number of different items that I get on the healthcare reform initiatives, so if folks would be interested in that, I can share that information, and perhaps that can spur some dialogue as well. Speaking of medical environment, healthcare access, as folks know, the state has been without a budget since the constitutionally mandated deadline of July 1. And as of Friday, as I understand it, they have reached a tentative agreement around the parameters of a budget. The budget number is $27.9 billion in state dollars. As you know, a lot of the state programs get matched with federal dollars, either through the Department of Public Welfare and CMS for Medicaid, as well as other state programs get a federal match. There's an increase in the FMAP, which is the federal matching percentage, this year under the Americans Recovery Act. The Stimulus Act is the ARRA. In any event, they do have an agreement on a spend. What gets included in the spend is still up in the air a little bit, and we're just preliminarily getting some ideas around what goes around with that. From a medical access environment for Radnor Township, the important piece is that the healthcare provider retention account, which is the fund that hospitals and physicians pay into for the MCare fund, that is going to be used, that entire amount, $700 and some million, is going to be used to fill a hole in the general fund. That's going to have a significant impact on the availability of MCare abatement, which has been utilized to retain physicians in the community. So that's going to have a significant impact there. I know, in fact, I was just on a call that the Hospital Association of Pennsylvania has filed a lawsuit relative to that, because that's some significant dollars that have been kind of hanging around in this account for years and have not been utilized either to pay hospitals back for the money that they put in or physicians. Another significant event is the Auto CAT Fund, about $44 million from a fund. This is when you pay your licenses and whatnot and fees to the state for your automobiles. Certain portions of those monies are devoted to different funds. One of those has been devoted to supplementing medical liability, the MCare fund. Those monies are going to be redirected to the general fund. So the impact on physicians, unknown at this point, but those monies will not be available for the MCare abatement, which has been used to pay for the MCare liability portion of the medical malpractice that physicians in Pennsylvania are required to have. In any event, so that's kind of the significant event at the state level. Stay tuned. There should be more parameters around how those monies will be spent Wednesday or Thursday of this week, and if I get anything, I can certainly share that with the committee. On the federal side, I'm sure everyone's very aware that the Senate Finance Committee has released their chairman's mark. It's significantly 300 million or so, 300 billion, I should say, less than the numbers that were put out by the House Tri-Committee, which was Ways and Means and Energy and Commerce. It does not, as I understand it, include a public option, which was the most controversial aspect of the Ways and Means proposal. But it does do significant funding shifts in Medicare, which again will impact physicians and hospitals. So it's clear as mud at this point, but hopefully we'll get some parameters around that. And again, whatever I can get, I'll share with the committee. So if there's any questions, I can hopefully respond. Great.
Actually, Mark, oh, no, I had a question. I don't know if you had brought this up in the past, but apparently there's a single-payer health care reform plan in Pennsylvania called HB 1660. This was brought to my attention independent of this group. But what was brought to my attention is the savings that these types of universal health care plans would have for municipalities and school districts. For instance, an independent study showed that these types of universal health care plans could save, for instance, Radnor Township currently spends $4 million a year on health care for its active and inactive employees. And under HB 1660, it's proposed that we would save approximately $3 million a year in health care. So our cost would be about $1 million. I would imagine that we would see the similar benefit or savings from a national health care plan. And I just wanted to bring this to your attention because I wasn't thinking in terms of what it would save the township. Everyone tends to think in terms of what will save me or how it will affect me. As you know, most townships and school districts have very good health plans, and these health plans are very expensive because in general terms, they're probably helping cover the cost of all the uninsured in the country and in the state and in the county. And these universal health care plans tend to help by spreading that burden among everyone that actually gets the benefit. And at least in the case of HB 1660 and also SB 400, which are Pennsylvania-based universal health care plans, we would see just that the school districts and the townships just on the main line alone would save probably about $10 million a year in health care expense. Yep. So I don't know if you want to talk about that.
I have heard about the bill you're talking about. A couple of different points. One, the devil is always in the details on these, and I would be interested in seeing the independent study because I've seen a number of different studies talking about single payer and the cost to the healthcare system. If you look at the Medicare, Medicaid, in a certain sense, they're single payer, and their cost overruns are burdening the state. If you look at insurance as a whole, you have kind of a triangle. You have the benefits that are available. You have the utilization, how much those benefits are being used, and then you have the pricing, right? And everything is going to be a function of those. And a single payer system, unless it's like Medicare or Medicaid that does not keep a reserve account, is going to have those same parameters. So there's no magic in being the sole player involved. It's a function of how much benefits you're going to provide. If they go to a Medicaid format, all right, limited benefit package, the utilization, the pricing they pay to hospitals under Medicaid is about 70 cents on the dollar. For physicians, it's far less. So if you went to a Medicaid program, and I think what you're talking about is Medicaid Plus, I think that was what they were talking about from pricing, the result will be a lot of physicians will be out of business pretty quickly. And a lot of health systems would have a dramatic impact. I know our health system, we lose money on both fee-for-service Medicare and fee-for-service Medicaid to the tune of millions of dollars, unsustainable losses. So potentially there are savings on the administrative side. The question becomes, are you going to be able to afford it on the access and provider side? So I'd have to see the numbers. I'd have to understand the detail of the plan. I don't want to debate things in a vacuum here, but universal coverage at a Medicaid rate or even a Medicare rate is unsustainable from a provider perspective. If you look at it from, if we're going to do something plus, Medicare plus, or whatever, it may be unsustainable from the administrative burden and on your end. So really something we would have to look at in its totality.
Just a quick question, Mark, because you're really the expert on this. Are the terms single payer and universal coverage synonymous?
Not in my view. Single payer. Single payer is, as I understand it, is one payer, most likely government-owned or government-managed or either government-sanctioned. You can get to universal coverage or near universal coverage through a variety of mechanisms. Commercial insurance, perhaps reforming the commercial insurance market, allowing for portability, no pre-existing conditions. There's a number of different things you can do on the commercial market to allow for a greater access. And then you have the Medicaid, which is probably one of the largest insurers of children and the disabled in the country right now. Pennsylvania is unique in that right now Pennsylvania is probably the 5th best in the country, 5th or 7th, I forget where they fit, in terms of number of insured. So Pennsylvania is better than 45 or 44 other states in terms of the number of insured in Pennsylvania. So actually we've done a good job in this state. A lot of the uninsured, if you look at it, are actually in the Sun Belt states, which are the right-to-work states. So they're the ones who are doing well, at least a couple of years ago anyway, in terms of economic growth. But they also have less of a requirement of a safety net and less of a burden on with regard to insurance and whatnot. So very multifaceted issue. Single payer, I think you look at it as kind of a panacea until you kind of peel the onion back, and then you create other issues that would not necessarily be addressed.
Can't imagine why animal health hasn't taken on the human insurance philosophy.
Maybe because it doesn't work so good. If for whatever reason, people seem willing to spend whatever they need on those on their puppies. I don't know. In any event, John, as you point out, very, very intractable issue and one with a number of different facets. Because as you look at single payer or multi-payer, but with the insurance reform, then it's where is personal responsibility in that, and then you get into issues of, the look at the taxing of sodas and things of that nature to try and drive better behavior, because most of the spend, if you will, on healthcare is really based on issues around systemic illnesses, diabetes and other things that are a major cost factor in the healthcare delivery system. It's interesting. I always cited a note about the fact that Medicare spends approximately half of the money on you within the last 6 months of your life or something to that effect, until somebody corrected me and they actually said that if you live past the age of 75 or something like that, the amount Medicare spends on you actually declines, because you're probably in good health and you probably have taken care of yourself. Where Medicare really spends a lot of money is people who have a lot of comorbidities, systemic illnesses and whatnot. That's where they really have to spend a lot of the dollars.
I wanted to bring up something about that. Which is that I think relates to us as a Board of Health. I was going to bring up that exact point that you're talking about, which is a lot of what we spend money on relates to things stemming from obesity. And, diabetes, heart disease, a lot of conditions have to do with obesity, and it certainly is a worsening problem among children. And the things that I've seen about this, the research in a way is just starting. They recently, pediatricians and family medicine physicians and internal medicine is starting to do some interventions, sort of practice-based interventions. But I've also seen a fair amount about community interventions that do seem to me to be maybe a little more promising. It's hard for me to see what a brief kind of office-based intervention would accomplish compared with community interventions. And I know I've mentioned before just some issues, even about what happens in the schools. In our middle school, kids only have gym for a quarter of the year. They have it for half the year, and they have it every other day during that half of the year. A lot of the sports and activities are not things that you can take with you. They're not lifestyle things. Swimming, for example, you can be on the swim team or you will never use the pool. It's not like they offer or encourage people to develop a 45-minute or hour-long swimming thing that you could take with you to college and beyond. I mean, pools are relatively available in this country. I mean, and, many sports, there are a couple of intramural sports offered, but many sports are not. You have to devote yourself to a team, and the sport itself requires a team and equipment and, officials and a lot of other things that you really won't have either, maybe even in college or certainly after college. So that sort of, and I know there have been, and maybe, other people have heard about other really community-wide interventions that have been done. I know up in Wilkes-Barre area, there was a $1 million meltdown that the whole, community got involved in. And so, there are things that, there are a whole variety of things that can be done in this community intervention idea. And I think it's I don't have the answers. I don't even have I'm just starting to think in this direction, and I wonder if it would be worthwhile for all of us to be, thinking about, is there a way to kind of move in that direction and things we could do as a board?
No, I think that's a wonderful idea, and I'm sure John would comment to that. I coach a lot of the teams, softball and soccer and whatnot, and you really seem to see a drop-off in the intramural girls teams in the 5th and 6th grade, which is kind of a shame. They have the travel teams and the school teams and whatnot, but there doesn't seem to be as much an emphasis on the intramurals, because when you're coaching 1st and 2nd grade with my daughter's teams, there was a whole phalanx of kids and they're all running around, and now you're trying to scrounge around to get enough kids to field some teams. So anything to promote that kind of activity, I think, would be a tremendous opportunity.
I can comment also on some of the things that we do from a Parks and Recreation standpoint in the township. We have a trail system in the township, but it's not really fully accessible at this point from all residents in the township. I finally got back on my bike this past weekend, and I rode the entire township from one end to the other and back, but it was very difficult getting from the Bryn Mawr section to the Wayne section to the trailhead. And it was dangerous in some ways because there were no painted bike paths on the roadways. Some of the curb cuts are missing along the path to get past the high school. So what I'd like to do, at least from the commissioner's side, is try to push along some type of connectivity to this trail system. It doesn't have to be a formal trail per se, but it could be something as simple as putting some gravel down along the Lancaster side of the high school that would help you connect to the trail. That, and of course, many times trail systems will extend into the public streets by putting a dedicated bike lane. We see this all throughout the city of Philadelphia, all throughout Chester County, but we don't see that much of it going on in Delaware County. So I think we should maybe collectively work towards maybe increasing that connectivity. I see that as a good behavior, a good alternative to being on a team or playing team sports, is because you can just get on your bicycle and ride. You don't have to arrange with anyone. You don't have to plan. You just get on your bike and go. And that would be another opportunity for people of the township to get into a healthier lifestyle. So any other activities, we have great activities for young adults through the various teams, whether they're school-sponsored or independent of the school system. And we have a lot of Parks and Rec programs. But again, those programs require participation and a thoughtful beginning, whereas just getting onto a trail or going for a walk is not something you really have to plan out. So maybe we could think in terms of the board working on some goals, setting some goals for increasing that connectivity or increasing outdoor activity for the residents of Radnor.
Great. I think both of those are tremendous ideas, and perhaps Amy, if you can follow up with John and talk about, not only do we have anything that describes what's available in one location at one resource. I don't know if it's under the Parks and Rec's website or not, but anything that kind of connect that and publicize that. Radnor Health Matters.
Okay. As the minutes indicate, for the last meeting, we had reviewed a draft number 3 of our grant application to provide citizens in our township with the emergency preparedness guide that we've reviewed in the past. At that meeting, one of the things that was pointed out was that there was no line item for the actual printing of the guides. Apparently, I had missed an email from the printer with those figures, and when I did get that information from the printer of the guides, I was able to plug that number in. Well, what that did, as you can imagine, was to increase the amount of money that we would have to be requesting to just over $16,000. At any rate, we've moved on since then. I did correct the budget for the proposal by that amount, and we finalized the drafts. I did sign the cover letter going to the foundation on behalf of Mark Bullock, and we submitted it together with a memo of transmittal to the township commissioners. And my understanding is that the commissioners did approve the proposal to go ahead to the Rite Aid Foundation. We are awaiting Mr. Masterson's signature on the cover letter, which is necessary. And once Larry informs me that we have that, I will get together with him and we'll make sure that, A, we have copies of the signed documents here, and that it goes out as promptly as possible. I hope that we can get it out before the end of September, even if it means, John, perhaps you can intervene and make sure Mr. Masterson knows that we're awaiting his signature. And the importance of that is that the foundation for this cycle will be reviewing applications during the month of October. So we want to make sure that we don't miss this cycle. Are there any questions about that before I go on to any other subject? Okay. With regard to the television studio, it's really looking very, very professional at this point. Some equipment has been moved in there. That's the good news. The bad news is that, as we all know, there have been staff cutbacks in the township, and that will curtail, to some extent, the availability of people to actually do the televising of that and the possible editing of any tapes. With regard to the latter, that's not a problem for me. I can, I'm comfortable taping straight through. We did that with the Studio 21 programs that we did without any editing. So that will not be an issue for me. Obviously, we've talked a lot about H1N1, and we're working now on putting together a program on that particular issue, and I hope to be able to coordinate people's schedules. We will have to do this during normal work hours because of the staff, Radnor Township staff aspects that I mentioned a little while ago. Any questions about that?
No, none for me. Anybody else? Great. Thank you, Herb. I appreciate that. We're up to new business. Any new items that folks, or any old items that
Yes,
have been
Yes,
referenced?
I have a new item I'd like to bring up real quickly. Just an announcement that on Tuesday, November the 10th, the League of Women Voters will hold a health forum discussion. This is to consider the need for creating a Delaware County Health Department. The forum will be held at the Township building here. I don't have a time, but I think it's likely it's 6 or 7 p.m. Participants will include the community leagues in Delaware County who performed an independent study and will present their findings at this forum. And the other participants will include the Delaware County staff who will present their opinions on this finding.
Thank you very much.
You bet.
And what time is that on the 10th?
It's on
That's it.
November 10th, Tuesday, but it's either 6 o'clock or 7 o'clock. I don't have a firm date or time on that.
Maybe we can find that out. 7
I just
o'clock.
told her it was 7 o'clock.
7 o'clock.
Either that or 5:20. 7 o'clock. That'll be, actually, that's very interesting, and again, significant for those watching at home, because other townships have a Board of Health and Health Commissioner, and other counties, I'm sorry, but Delaware County, as I understand it, does not. Interesting.
And just with H1N1, as an example of that, for example, Montgomery County is expecting they have the ability, because they're a county-based health department, to accept federal funds via the state to hire additional staff and to hire people. Actually, I believe they're using the same company that does our flu-miss clinics, and they're expecting to be offering H1N1 vaccines at all elementary, middle, and high schools in Montgomery County, because they have the ability to accept these funds and accept the vaccine and sort of orchestrate this whole thing. And we really don't, because we have to kind of communicate directly with the state. And, the state just doesn't have that ability to, to deal with any one particular county like that. So, here's one concrete example right now of where we're not doing something that our neighboring county is able to do.
Interesting. I think there'll be a lot of important discussion and presentations there on all sides of the issues. Larry, I was going to ask the trans fat program, how is that doing? Actually, my family and I went to the farmer's market there and went to eat at the little luncheonette that they have, and they actually had our little sign up there on trans fat, so I was just wondering how that program was going.
It's pretty much at a stalemate. We, we only have so many food facilities, and they've all the ones that were going to pledge have pledged.
Oh, great.
So,
So we're at 100%.
well, I wouldn't say 100%, but we're doing pretty good.
Good. Well, that's good to hear. Anything else?
Yeah, it looks as though the same five of us who were here June 15th are here today. There are a couple of members who have not been at these meetings for some time, and I don't know what the rules are with regard to that. And that's maybe an issue that we can discuss in the future. At the same time, we do have and have had a couple of vacancies on this board, and I'm wondering if we can know the status of filling those vacancies.
I have one. I think that we should explore what the rules are with regard to attendance offline. So that's something we can follow up with Larry and John with. I have discussed with some folks in the township about participation. Casting my net out there, but I have no takers. I don't know if anyone else has had an opportunity to talk with anyone.
I have one person who is interested, and I'm going to be speaking to them this week.
And I know of one person also. We'll be talking with them.
Great, excellent. So at least we have two on the line, so to speak, so hopefully they'll bear fruit. Yeah, reel them in.
I had one other thing I just wanted to mention. Recently, I've been seeing a lot of unvaccinated animals for rabies, sustaining wounds of unknown origin. So unfortunately, there's a lot of quarantine that's happening. And I just want to encourage everybody, even if you think your cat specifically, it seems to be a problem with, is just staying in the yard or is just indoors. We see plenty of these animals being exposed to bats that may fly in the house. There are animals, when they're rabid, they actually break into homes. In fact, last Labor Day, we had 5 indoor-only animals exposed to rabies from animals, rabid animals breaking into the homes. So I just want to encourage everybody to get their animals vaccinated for rabies, and it saves a lot of problems for your animals and for yourselves.
Thank you very much, Doctor. Obviously, very important, not only for your pets, but for the community at large, a very important issue. You had talked about a couple of meetings ago about this virus or something that's spreading in the bat population. Any more on that?
The white nose syndrome in bats, it's a fungus. They really haven't identified why it's a continued issue. Seems to be more of a chronic disease. There haven't been a lot of reports, new reports on it, other than we're still finding them, and it is progressing right down the East Coast, having an origin, or at least thought to be, from New York. So I think it's taking its toll, but nothing really new on treatment or prevention.
Thank you. And not to prolong, but your presentation to the Board of Commissioners was, when was Dr. Donato's presentation? That was?
In respect to the deer?
The deer, yes.
Yeah, it was about a little over a year ago. So in December, I'm planning on reevaluating the numbers, seeing where we are, see if any other action needs to be taken.
So we could perhaps look at something in December then, when you have a year or more's worth of data. I think that would be important.
Yeah, the signage went up, was I think mainly last June, July, August, so we can look at the numbers fairly soon.
Great, excellent.
Mark, on your left, I'd like to just thank Herb for working on the grant application. I appreciate you doing that. We're certainly having a lot of financial difficulties paying for mailings and whatnot, so that grant application could really come in handy. I also want to thank Dr. Donato for getting involved. We had a feral cat problem in Garrett Hill it's about a month ago, and Larry and Len got involved, and we were able to have an outside group come in and do a trap, spay, neuter release program for these cats. I actually did not get an update on that process to see where that ended up, but this was not a township-wide issue. It was more of a neighborhood issue, but I would imagine at some point it's something that we want to look at from a township standpoint and, you know, get away from the old process of the police trapping and delivering the cats to the SPCA, which in turn would be euthanized. So, you know, this is a nice program. We're not releasing the cats back into the neighborhoods. We're taking them to a sanctuary somewhere. So maybe Len could comment on that.
Yeah. They found the small group that I called in when we originally thought it was 4 or 5 cats. It's now 23 cats later. They're rather overwhelmed, but it's nice. We're starting to disperse the cats among a number of different groups, so everybody is lending a hand. But the cats are actually found to be very nice, and they're going to adopt them all out. I think there may be one. They may not be able to, 1 or 2, but they're doing a great job, and we're getting some of them spayed and neutered and moving them on to homes. There's also, which I'm not sure, I didn't know about this before, but a colony that is also along the Radnor Trail, where another group is trapping, and they may do TNR, trapping and re-releasing. But I know the ones that this small group is going for, they'll be able to be adopted. Worked out pretty well.
Wonderful. Well, thank you also for your work in the township. I think townships like these are certainly made better by the participants, the residents' participation in a lot of different things. And John, thank you for your leadership on that. I'm sure the community there appreciated that very much. Although the mice probably like the former police procedure, but they probably don't like this one so much. In any event, I appreciate everyone's time and efforts, and look forward to our next meeting. Meeting is adjourned.